Hello friends, this is Transconnect December 2023 and today we are talking about blood donation and its associated myths, how we are going to counter these myths, we are going to bust these myths and how we are going to tackle the situation which occurs in every day-to-day working of blood donation. For this, I am going to hand over this episode to Dr. Ankita Sharma, who is going to take you through this important topic.
Thank you, sir. So now we'll be talking about the blood donation myths under the following headings. A brief introduction, some literature data on the donation myths, briefing of each myth and debunking them with a proper rationale, the impact these myths have on the donor population, and what is our role as transfusion medicine specialists in debunking these myths and in allowing and promoting donor motivation. So, coming to blood donation myths. So, we all know myth is nothing but a widely held but a false belief or idea or a misconception or a misinformation, the impact of which can range from something being relatively harmless to something which can cause very bad decision or negative consequences. And when it comes to blood donation, these myths are sadly but deep rooted in the public, and therefore it's important to address them so that we can have a good donor pool in our society. And the myths associated with blood donation, they can arise at any stage of donation, either pre-donation, during donation, or post-donation. So we'll have a brief look on the literature data on blood donation myths. This is a global data. Various studies have been conducted all across the globe, not just in India. And here the donors have been asked, like what prevents them or what makes them reluctant to come forward for donating blood. So, as we can see here, most of them have certain misconceptions, like they're afraid of contracting a particular disease, especially HIV or hepatitis B, hepatitis C. The fear of needle is a big problem. The fear of being blood donation being a painful procedure, that it is time taking. The fear of having any adverse donor reaction, because if somebody is in their friends or families had a similar episode, so that misconception, that doubt remains that even they may encounter it, which prevents them from coming forward for donation. And again, so most of them do not even know what is the advantage of blood donation, how what a philanthropic act it is, how they can contribute in the society. And lastly, some of them are also afraid because their blood is tested for various diseases. So they are afraid of discovering any illness, knowing their HIV status, which is associated with the stigma. So all of these causes are what are the common blood donation myths and which prevent people from coming forward. So now some common myths as we discussed. Basically, some of the myths are related to the age and gender, the physical appearance, the tattoos, the fact that it is a time-consuming process, or that the blood type is very common, so it's always in surplus availability, it's not required. Then the fear of needles, fear of contracting an infection, the painful procedure, the fear of having any adverse donor reaction, certain condition of the donors himself or herself which prevents them from donating, like they have certain disease association, certain drug intakes they have, or a fear that they'll become weak, they'll become anemic, they might lose their infertility or vitality because of the fear of collecting excess of blood. So now we'll address each of the concern individually. First is qualifying age. So people have this dilemma that they are either too young or too old to donate blood. So, or before we discuss this further, all of these rationales are being explained on the basis of our government guidelines, the DGHS as well as our Drugs and Cosmetics Act. So, as per the Act, we know age, there's a specific limit as mentioned in the national guidelines. The minimum age is 18 years and maximum being 65 years. If there is a first time donor, then he or she should not be over 60 years of age. For references, the age is 18 to 60 years. Now, this age is very important because it's a blood donation is a legal thing. So, somebody has to be of the legal age, as well as for extremes of old age, it's associated with their disease condition, with their general health. Therefore, the age is what is very important. And a person who's lying between the age spectrum, the appropriate age spectrum, he or she can donate blood provided they comply with the other selection criteria. Next is I have a tattoo, so I cannot give blood. So again, tattoos are basically kind of needle prick injuries. So in such cases, such donors are often at risk for hepatitis by means of tattoos, any acupuncture, body piercing, scarification, or any other invasive cosmetic procedure, either by itself or by the spouse or partner. In such cases, such donors are deferred for a period of 12 months, which is usually for like a window period. If there's any infection, it can surface up and can be detected. However, once the specific deferral period has lapsed, these may be considered for donation if they are in compliance with the other criteria. Next is the physical appearance. Like people believe that only a well-built, a very muscular person can donate. No, it is not at all true because blood donation has got nothing to do with somebody's physical appearance. What is important is the body weight because it is in compliance with the blood volume. So if we are collecting 350 ml of whole blood, then a minimum weight requirement is of 45 kgs. And for 450 ml of blood, it is more than 55 kg. For references, it is 50 kgs. So physical appearance is nothing but weight is what matters when it comes to donation. Next is I'm a woman, I cannot donate. The gender bias. Male, female, they can both donate. It's not an issue. For females, of course, there are certain criteria which need to be considered as a special case. Like if they've had a pregnancy or a recent delivery, they have to be deferred for 12 months. If they are on lactation or menstruation, they must be deferred for the period of menstruation or the lactation. And if there's abortion history, then they must be deferred for up to 6 months after abortion. But in either case, a non-lactating, non-pregnant, non-menstruating women, they're always welcome to donate if they are in compliance with the other criteria, especially the hemoglobin. So now we'll take up the fifth myth, that is, I'm suffering from a certain disease, so I cannot donate. That is the disease associations. That's a very common assumption that people who are diabetic or on hypertensive medications or thyroid, asthma, etc., they cannot donate blood. Now, this is true to some extent, but there is a certain categories of diseases where individual can donate and where individual cannot donate. And these are all addressed individually in the Drugs and Cosmetics Act. So this is important because here is where our role comes a lot in the picture that as a blood bank physician, as a transfusion medicine specialist, it's important that all these concerns are addressed. All the diseases are talked about in depth at the time of screening because if we are going to accept a donation, we should know, and so should the donor, about the disease condition. And if they are being referred, then they must be counseled to them properly so that they can be aware, they can be made aware about the condition, and that if they are being referred permanently or a temporary deferral is being advised to them. And if temporary, then what is the duration? This is very important because this will allow the donor to leave with the impression that the concern has been addressed properly and they will go in a relaxed state of mind. And so the same can be communicated to their families also by them, which will again help us in clearing out the myths. So these are some commonly encountered diseases which are permanently deferred and temporarily deferred. Some permanently deferred diseases include, of course, all the transmissible diseases, especially HIV/AIDS, hepatitis B, C, autoimmune disorders, certain malignancies, cardiac disorders, any STDs. And temporarily deferral is there for different diseases, and each of them has a different period of time for deferral. Diseases, some which we commonly encounter are typhoid, which has a deferral of about a year, dengue, malaria, chikungunya, the deferral will range from 3 months to 6 months. Tuberculosis, there's a history of measles, mumps, chickenpox, conjunctivitis, any UTI, etc. So now addressing our sixth myth, that is medications. People have an assumption that if they're on a certain medication, they should not be donating blood. Such information is usually conveyed to them maybe by their friends or family, their peer circle, or maybe if they've read some article somewhere. However, it's very important that they should be aware again about their medication status and how it is related to their blood donation. So certain common assumptions are that diabetic or hypertensive patients or people rather, they should not be donating blood. No, this is not the case. Of course, certain drug status can be accepted. Some of them have a permanent deferral, some may have a temporary deferral based on their duration and the dosage, etc. And all of this is again given very nicely and clearly in the Drugs and Cosmetics Act. And here also, as a transfusion medicine specialist, as a blood bank physician, it's important that we are counseling the donors. We're taking a detailed history about their medications, each and every medication if there are multiple, and the same correct information is conveyed to them with regard to the donation status or the possibility of being a donor in future. So these are the common medication that we encounter. Number one is what we can accept. We have a lot of females who are on oral contraceptive pills. They can donate. OCPs are not a deferral for donation. Those on vitamin supplements, some analgesics, mild sedatives, they can donate. In cases of any antihypertensive medication, any oral hypoglycemic agents, the donors can donate blood. However, important is the medicine should not have been changed in the last 4 weeks or the last 1 month. If changed, then they should wait for another month. If the doses are not being changed, they're stable, then they should be donating blood. This is important because this is an indication that probably the medication levels are not yet suited to the body. There is fluctuation in the sugar or the blood pressure. So body is not fit for donation. Next is when we can defer is temporarily. Certain salicylates or non-steroidal anti-inflammatory drugs, some anti-helminthic drugs, antibiotics, etc. So the deferral will vary from about 3 days to 2 weeks. Then isotretinoin, etc. for 1 month, finasteride 1 month, dutasteride 6 months. So again, this is a temporary deferral with a certain defined number of days or number of months. However, permanent deferral includes insulin, thyroid medications, any cytotoxic drugs, seizure medications, cardiac drugs, any anticoagulants, etc. Now, the seventh concern is having a surplus stock assumption. People believe that they don't have a red blood type. So, for them, it's not really required that they should be donating. It is a big myth that's very, very important to understand that not just India, but at a global level, there's always and always a requirement of blood. We have multiple patients who are undergoing multiple procedures, their surgeries, a lot of people who are dependent on transfusion, maybe chronically dependent also, like thalassemics or patients with sickle cell disease, certain patients with oncology. They're all dependent heavily on blood and blood products. And this requirement can be seen right from the primary health centers up to the tertiary care hospitals. So therefore, if a blood group is common in the public, then the patient population will be a sub-cohort of the same. And it's very important that the donation pool is maintained so that these requirements can be met in a timely manner and safe blood supply is available. And also, not just the blood group, but from the whole blood, we are making components which can be given across the groups. So the point is that the blood is not going to get wasted. It's therefore the surplus stock assumption is a big myth and should be debunked. Next is that it's a time consuming process. It takes a very, very long time to donate blood. Usually people come on their week offs or their some holidays and they feel that they're wasting time because it's very tedious process. Now it usually takes about half an hour to 1 hour maybe for a donor to enter the blood bank and exit after donation. This all may sometimes vary depending on the rush of the donors, if there's been a reaction or something like that. However, important is the time of phlebotomy. The average draw time should be around somewhere 8 to 10 minutes, maybe, not beyond that, because beyond that, the products are not really fit for donation or for use. However, what is the additional time taking process is the data entry when we are making the donor rest for some time. There is some refreshments or feedbacks being given. This is where the time takes place. Time is taken, and every blood bank makes a lot of effort to minimize this time to make it at the minimum so that the donor can leave in a timely manner, they are satisfied with the services, and that the time is not wasted. Then the fear of needles or fear of blood. This is a very important and a very, very rampant myth that it hurts to donate blood. It's a painful process. We need to counsel the donors at the time of donation, I mean before donation and during donation as well. We have to explain to them like it's like a slight pinch. You can use side examples like the time of vaccination or when they're giving some samples for routine testing. The pain or the slight pinch that they experience is the same, and this pain is very well within the tolerable limits of the pain scale. And we have to explain it to them that this pain is a subjective. What is in lieu of what they're actually doing? They're helping in giving somebody a shot of life, so they can bear this mild pain. They're helping to save someone's life. And proper good pre-donation counseling can help in alleviate these psychological fears and make donation a comfortable procedure for them. Now the 10th one, that a lot of blood is taken, like the collection volume will be too much, so I'll become anemic or I'll become physically weak, there'll be permanent weakness, some loss of vitality, etc., loss of fertility in many cases also, what people have addressed as a myth. So now important is the collection volume is in correspondence with the body weight. for a 350 ml of whole blood is collected in the case of a 45 kg weighing donor, and 450 ml is taken from donors who are weighing at least more than 55 kgs. And for references, the minimum requirement of weight is 50 kgs. Now, these above parameters, as we said, they are in correspondence with the ideal volume of the blood being collected. And all of the blood centers, they have proper collection equipments, the biomixers, which will monitor the volume which is being collected. An alarm is set for the once the blood is reaching the cutoff value, it alerts the phlebotomist, and the donation procedure is stopped there and then. So, no cases any extra blood is being collected. Next is the 11th myth, that is, they have a fear of contracting a disease. I might contract a disease if I donate. Now, we know as a medical specialist that donation is a entirely healthy and safe procedure, but the same must be conveyed to the donor also. It's important that the donors are taken to the phlebotomy room. We can show them that how we are using only one-time single prick needles, one-time disposable sterile instruments are being used for everybody's fresh bag is being used, a proper cleaning of this phlebotomy site, and we are maintaining all asepsis is being maintained strictly, and that there's no evidence of contracting disease during donation. Explaining the donor, making them see all this will help to alleviate this fear from their minds and make them more comfortable when it comes to donation. And lastly, the fear of adverse donor reactions, that they feel they'll become weak, they might faint after donation or during donation. Now, this myth, it usually stems from a certain unpleasant experience of somebody who has donated blood, maybe in their friend circle, in their family, some colleague who has had a similar episode in the past, and that instills fear in the mind of the donor who is coming for donation. Now, post-donation reactions, they do not occur in all donors. Of course, they may occur in some cases, but it's not a thumb rule that every donor is going to experience these. And what is important, how you can help to cite them to some extent is by certain red flag signs for checking out for dizziness, for syncopal attack, hypertensive episodes. Like, you have to take proper history. Like, have they slept properly? Did they travel overnight? Did they have a night shift? So, adequate sleep for at least 4 to 5 hours is important, a sound sleep, because body will be in a resting state that time. Then coming to the fact that they have eaten anything or not, they should have had a light but a filling meal. And important is that they should not be donating right after eating. There should be a certain gap so that the food is digested a little, but the gap should not be beyond 4 hours. And also the hydration status is very important because it helps to maintain the blood pressure. Therefore, we always emphasize for donors to donate blood. Before donating blood, they must have an adequate intake of water, and also after donation, a fluid intakes are advised. This is more encountered when in female donors, some first-time donors who are anxious donors, etc. And this can be, I mean, we can help to overcome this by stringent screening practices, proper pre-donation counseling, and safe phlebotomy practices to ensure this donation is a hassle-free and a safe experience for all the donors. Now, what is the impact of the such myths on the donor population? How they are affecting our donor pool? It will affect the voluntary donor pool of the society. This we know very well. Next, it will affect the numbers of the first-time donors because, of course, somebody, if they have any kind of a doubt or a myth, they will not come forward. They feel reluctant, hesitant. So this affects the number of first-time donors. It will increase the fear against donors. So at least those who are coming, but they'll have that fear, the stressful state, and which will aggravate the likelihood of having a donor reaction. And this also leads to a psychological impact on donors and their families. And at the same time, it will ultimately lead to a major role in self-reference. So now, what is our role as transfusion medicine specialists in donor motivation? We must make an attempt to create awareness about the donation process and wash out all the possible myths in the people's mind. For this, what we can do? We can organize some proper and regular motivational campaigns in colleges and offices, universities, to recruit more voluntary and non-remunerated donors to clear their doubts, their misconceptions. There must be introduction of a dedicated curriculum about blood donation and transfusion medicine. It must be incorporated in the schools and colleges and undergrad programs so that the myths about the same can be debunked at the very grassroots level. Because Why so? Because there's a early access to correct information, which students or people are very likely to share with their family members, and it will also help in clearing the doubts of their family members. So indirectly, if not the students, we are at least approaching their family members and getting such doubts cleared. And it's very crucial to educate the public about the importance of blood donation, what a philanthropic act it is, and how they can contribute to the healthcare system. We can also explain to the donors about the advantages of blood donation, like how it is beneficial for them and not just for the society. Blood donation allows the production of new blood cells, which starts immediately after you donate blood. And this is the body's mechanism to replenish the lost blood volume and cells during donation. This also enhances the functioning and the efficacy of the hematopoietic system and the cardiovascular system because the fresh blood will have fresher RBCs which have better oxygen carrying capacity. They allow better circulation and gaseous exchange around the vital organs, allowing resulting in the better working efficiency of the organs. The donors can also get an overall idea of their health status based on the screening test results. And we can also acknowledge the donors and appreciate their participation by certifying them as a valuable donor. And this proud feeling and joy of saving a life is a bliss. It is irreplaceable. So this will also allow the donor to live with a good, feel good factor and make them feel good about themselves. The next is we also need to address these myths in another manner. That is, the transfusion and blood donations are relatively risk-free medical procedures. This is known knowledge for people who belong to the medical or the healthcare facilities. However, it is important that the beliefs and knowledges about the same may influence these operations when it comes to the public. Therefore, it's important to conduct surveys regarding the same to know about the knowledge, their attitude, their practices, and the misconceptions, because all of this will help the blood donation centers to develop their future policies, which will allow people to motivate people to donate blood, to urge donors to continue donating blood on a regular basis, as well as inspire the non-donors to start donating blood. So these are my references. Thank you and do donate blood.